and welcome to the session of Nursing Management and Pharmacology. This is a session in Fundamentals of Pharmacology for ATP 2025. So the learning objectives of this session is to learn about drug calculation and then to learn the report process for medication error and addressing steps that nurses can do when they need to address medication error. So first of all, let's review about this. You have what we call calculation of drug dosage. So this is basically the drug calculations that you have been learning since your session of tutoring. So we taught you about oral medication, parenteral medications, and also specific medications that will happen by the end of the tutoring classes. So why we need to learn about drug calculations? Because we need to determine the correct dosage for a patient and necessary to consider the patient's gender, weight, age, physical condition, and as well as we sometimes when we are doing the calculations of the drug dosage, we do not have the exact dose for the patient needs or the required dose. So that's why we need to do some dose conversion, and we need to do drug calculations as well, and we need to perform mathematical calculation because it's our responsibility as a physician, pharmacist, and nurse. And as nurses, we know that we must understand how to convert medications order into a dosage form that is then ensuring how the patient receive the correct dosage of the medications prescribed to them. We learned a lot about measurement system. We have what we call metric system. It's in gram and liter. That's the common used one. But we also have the household system with the ounces and tablespoon and teaspoon. We also have another metric unit, metric system called a unit, and also milliequivalents. And you'll see this a lot in insulin as well as in heparin. So we use this type of calculation. And when we do conversion, as mentioned, that you need to do the calculation, you need to understand and remember that a gram is equal with 1000 milligram, a liter equivalent with 1000 milliliter, a glass equivalent with 240 milliliters. And when we talk about 30 milliliter, it means we have 2 tablespoons. And when we talk about 1 tablespoon is equal with 15 milliliters, or equal to 3 teaspoon. And when we have 1 teaspoon, it means that 5 milliliter, and it's equal with 60 drops. And notice that this is what we normally use, and we use the spoon, a little one, in the medication that we are going to give orally. And also this one is sometimes we use a buccal, the one that we use to give oral medication. Now we'll learn about drug calculation formula. So you'll learn through your tutor that you have the enteral and parenteral medication. So the enteral medication, it means a tablet 1. You have the required dosage divided with the available dosage time with the table available. And the same with parenteral medication. You have the volume required, you have the required dosage, and then you have the available dosage times with the volume available. Now we learn about intravenous fluid. So you need to understand that we have the micro drips, 60 drops, and then we have the macro drips, 15 drops mil. And what you need to do is when you are calculating its drop per minute, so the required dosage in volume divided with the required time in hours. And here you have to divide it, the drop factors, with 60 minutes. And you have also what we call the flow rate. This is what you use the infusion pump. So you have the required dosage divided with the required time, and that has to be in hour. So you get the milliliter in hour from here. Now we talk about the formula for pediatrics. So you will talk more about this when you are learning pediatric nursing in the years to come. But then you have to just understand that there are few specific measurement to divide the pediatric dose, because as we know that the children, they are really small, their body is small, and then we just needs to calculate it according to the body weight. So sometimes also medication have the body surface area method, so you just make sure once you are serving in the pediatric ward that you calculate, double check the given dosage with the dosage for pediatric. Now how let's learn about the steps to prevent medications error. So the first one, that you prepare only one medications for one patient, and then you adhere to the 6 rights of principle. Then you read the medication label 3 times at least, and then you use 2 pieces of patient identification when you are going to administer it to the patient, and you always review the patient allergy each time. And then you do not engage in any other activities that interfering with the medication administration process, and then you have to recheck the medication calculations and the administration processes, as well as you do the double check with the senior or competent nurse, and then you do the recheck usually if the is unusual large or small medication dosage. And then you document all the medications administered for sure, and then you get enough rest so that you are focused when you're going to take care of your patient and giving medication. And then you involve the family and you provide education during the medication administration, as well as you adhere to the policies and procedures with the technology that are used in your facility to manage medications. As well as there will be like lots of training programs that will focus on frequently prescribed medications at your facility, so make sure that you join also so that you understand how to do it very well. Now, if you cause or you see any medication errors, what you need to do? So you need to report immediately. The reporting will go from you as the nurse on floor to the in charge nurse in your shift, and then you will be then going to the head nurses, and then they will process it according to the standard operational procedures that happen. So this is the way of you doing the incident reporting. Normally, you will report, this is just an example of how we report medications error within the Siloam Hospital. So you will report to the in charge, you report to the doctor, you report to the responsible doctor, and then you report to the duty manager. So always the nurse in charge, and then the head nurse, and then the doctor in charge, and then the one that responsible, and then the duty manager, and then we will then figure out what is need to be done according to what is being given wrong. And as nurses, you need to monitor the vital signs and the medication side effects, and the doctor will also need to come and examine the patient's condition, and then the duty manager, they will report to the pharmacy and then figure out where the problem got wrong. And then as nurse, you need to complete the root analysis, and then you need to see what medication what is administered, what's the patient condition, and what happened. Then you will write it as a chronological incident report. Now, in evidence-based nursing, we have a research done in Siloam. So that's a closed-loop medication administration, and this has been proven to reduce the incidence of medication error. So what you do with the closed-loop medication administration, you do the patient barcode, you do the medication barcode, and you do it through electronic medical record, and then also physician really just input it to the medication through the system. Alright, so these are the references and reading assignments for you for session 2B, 3A, and 3B. Please make sure that you finish it from these 2 books, and happy learning!